early on by the economic effects of the pandemic and the lockdowns instituted by governments around the world. The pandemic is now spreading rapidly across the continent, placing health systems under pressure and forcing African governments to make tough choices about how to mitigate the risks and manage the economic fallouts. Gibbs, in collaboration with the Institute for Security Studies, undertook a 15-country study of the current and future impacts of the pandemic on Africa. The research involved a series of qualitative dialogue engagements with representatives from 15 African countries, as well as a quantitative forecast of the future economic growth, mortality, income, and poverty trends expected in Africa as a result of the pandemic. The process harnessed participative scenario planning and used the International Futures Forecasting Platform of the Frederick S. Pardee Center for International Futures at the University of Denver to create a robust forward view of the impacts of the pandemic out to 2030. Covid-19 is not only a health crisis. The health impacts of the pandemic have economic consequences, and these, coupled with efforts by governments to mitigate the pandemic, has serious social and political consequences for the continent's future. The study sought to explore the impacts of these knock-on effects on Africa's long-term future. The key findings of the study indicate that Africa's economic trajectory will be severely affected. The study results in a series of policy recommendations that will assist Africa in responding to the pandemic. Compared to a pre-COVID growth forecast of an average 3.8% GDP growth from 2020 to 2030, Africa's economy is now expected to contract significantly in the short term. Depending on the duration of the contraction, Africa's recovery is expected to take the shape of either a V, a U, or L-shaped growth curve. Under a V-shaped recovery, growth is expected to return to pre-COVID levels by late 2021. Long-term growth is expected to average 3.1% from 2020 to 2030. Under a U-shaped recovery, growth is expected to return to pre-COVID levels by mid-2022. Long-term growth in Africa is expected to be an average of 2.8%. Finally, under the L-shaped recovery, growth is expected to return to pre-COVID levels as late as 2023 and be reduced long-term to only 2.4%. While growing slower than before, Africa is still expected to outpace the world's GDP growth by around a percentage point. The slowdown in the African economy will reduce GDP per capita, a good proxy for average levels of income. GDP per capita may take 3 years to recover to its 2019 levels, or in the L-shaped scenario, may only get back to 2019 levels by 2030. Africans will have been set back by between 3 and 10 years in terms of GDP per capita due to the pandemic. The economic shock from COVID will likely see the number of extremely poor Africans increase by 14 million people in 2020. While as many as 570 million Africans were expected to live in extreme poverty by 2030, up from 470 million in 2019, this number could increase to as many as 620 million in the U-shaped scenario, 640 million in the worst-case L-shaped scenario, and still as many as 607 million in a best-case V-shaped scenario. This means that between 37 and 70 million additional Africans will suffer extreme poverty in 2030 due to the pandemic compared to pre-COVID expectations. Instead of a decline of poverty as a percentage of the total population in Africa from 36% to 33% as was expected before the pandemic, poverty levels will now be stable at around 35% in the best case and likely worsen to 37% in the worst case L scenario. Under Under each of the scenarios, mortality in Africa is expected to increase not only from COVID-19 directly, but from the secondary knock-on effects of the pandemic, particularly the reductions in health expenditure that will follow from its economic impacts. In the V-shaped scenario, for instance, as many as 703,000 additional respiratory deaths are expected and just under 1.4 million other deaths by 2030 due to the pandemic's lasting impacts on African populations. These numbers increase significantly the longer the economic slowdown continues. In the U-shaped scenario, we expect just over 1.8 million additional respiratory and just under 1.8 million other deaths by 2030. In the L-shaped scenario, the numbers are slightly below 3.6 million additional respiratory and around 2.2 million other deaths by 2030. Overall, an additional 2.1 to 5.8 million people may succumb to the direct and indirect effects of COVID-19 by 2030. Because countries will experience sharp contractions in government revenues and hence a reduced ability to provide services including security, the pandemic will likely raise tensions and lead to new conflicts. This is particularly likely in countries with weak state capacity and authoritarian systems. The pandemic has highlighted weaknesses in the basic infrastructure of African countries, especially as it relates to the provision of clean water and improved sanitation. Only 40% of Africans have access to improved sanitation compared to 80% in the rest of the world, and only 78% have access to clean water compared to 97% in the rest of the world. African governments need to prioritize the delivery of these services, especially in urban settings where Africans live in high-density informal settlements and are vulnerable to communicable diseases. The economic slowdown, coupled with high levels of pre-COVID debt levels, means that the continent now faces a debt crisis. As growth slows, revenues will be constrained and African governments will have very little fiscal space within which to maneuver as they seek to counteract the impacts of the pandemic on their economies. This places additional pressure on their capacity to deliver basic services such as health, social security, and education. Our research suggests that various interventions will be required, including an extended debt standstill. In certain cases, countries are in danger of a default and may require debt forgiveness and cancellation. Long-term, African countries will need to transform their economies to be more labor-absorptive, more productive, and diversify away from their growing reliance on commodity exports and food imports. This drive to transform Africa's economies and accelerate growth is now crucial if Africa is to manage its debt burden and escape from slow development. Finally, the pandemic has shown how a lack of investment in Africa's health systems make countries vulnerable to the burden of disease, and how this undermines the overall economic and social well-being of Africans. African governments will need to significantly increase health spending and harness the innovations and interventions arising from the response to the pandemic to improve access to health services for Africans. The COVID-19 pandemic is a major setback for Africa, and its impact is set to linger for many years. Africa's leaders need to address the foundational aspects required for development, such as good governance, investments in enabling infrastructure, and a productive relationship between African governments and the private sector. By harnessing the crisis to accelerate the implementation of the Continental Free Trade Area, digitization, and move towards interventions that stabilize public finances, improve health, water and sanitation access, African countries can begin to transform their economies to be more inclusive and sustainable. This is crucial if Africa is to develop the resilience to overcome the crisis today and navigate future challenges such as climate change.